Hello everyone. In this video, I'm going to talk about promethazine. Promethazine is a medication classified as an antihistamine. Because of blocking of histamine action, it can be used to treat allergy conditions. It can also be used to control the nausea and vomiting as an antiemetic. Promethazine can also block the dopamine receptors in the brain, and it is chemically classified as phenothiazine. Normally, phenothiazines are used as antipsychotics. However, this medication is useful in the treatment of nausea and vomiting. This medication can induce sedation. Therefore, it can be used either pre- or post-operatively. But before using this medication, you should know important facts. What is the effect of this medication on GI motility? How does it reduce blood pressure? What is its effect on the eye, bladder, and prostate? How is it affecting the body temperature? What are the adverse effects on movements? All such facts are essential to know, which will be covered in this video. First, let's see how it works. Promethazine acts by multiple mechanisms. It mainly blocks the H1 receptors located on the chemoreceptor trigger zone. This is the area in your brain that induces the nausea and vomiting due to any signaling towards toxic chemicals in the body. By stimulation of these receptors, they can further send the signals to the vomiting center. That results in emesis. Promethazine selectively blocks these H1 receptors. Thereby, it can inhibit activation of CTZ. This may result in the prevention of stimulation of the vomiting center and block the cholinergic actions. That's why this medication shows anticholinergic effects. Apart from this action, promethazine can control a few neurons in the brain that trigger nausea and vomiting. It blocks the dopamine receptors at the postsynaptic neurons, particularly at the mesolimbic pathway. It can block the dopamine D2 receptors. Normally, blocking these receptors may result in antipsychotic effects. However, promethazine is not producing significant antipsychotic effects. It has only 1/10 of the activity of neuroleptics. Instead, it can produce an antiemetic effect by reducing stimulation of CTZ through dopamine signaling. Therefore, the antiemetic effect of promethazine is partly attributed to its antidopaminergic action. Promethazine also blocks the alpha-1 adrenergic receptors, which are responsible for controlling the blood pressure. How to take this medication? Promethazine is available as oral tablets as well as syrup. It is also available as suppositories and solutions for injection. As an oral tablet, it is available at different strengths such as 12.5 milligrams, 25 milligrams, and 50 milligrams. As an oral syrup, it is available as 6.25 milligrams per 5 milliliters. This medication has readily absorbed, however, only 25% of the medication enters into your body when you take it by mouth. This amount is sufficient to produce an antiemetic and antiallergic effect. For treating allergic conditions, it can be started at a dose of 25 milligrams oral tablets at bedtime, or it can be given as 2 divided doses at 12.5 milligrams. For controlling the nausea and vomiting, the dose may be variable from 12.5 to 25 milligrams. The dose can be repeated every 4 to 6 hours based on the requirement. For treating the motion sickness, it can be given 25 milligrams 30 to 60 minutes before the departure. It can be continued at a similar dose for the next day in the morning and evening, if required to control nausea and vomiting. Promethazine can be used to induce sedation either before or after operation. It is given at a dose of 50 milligrams on the night before the surgical procedure. Now let us see the precautions of promethazine. Promethazine can impair body temperature regulation. This may result in either decreased body temperature or a raise in the body temperature when you are exposed to high temperatures. Promethazine is having anticholinergic effects. This may result in a decrease in the body secretions, even decreases in the sweating. Therefore, the use of promethazine may impair heat dissipation when you're having heat exposure or under strenuous exercise. This may increase the risk of raised body temperature. Due to its anticholinergic effects, it can reduce your gastrointestinal motility. This is important when you're having a history of constipation or decreased GI motility. Therefore, in people with any bladder neck obstruction or peptic ulcer disease, this drug should be carefully used. Promethazine can produce another condition called xerostomia. It is a dryness of the mouth that is due to anticholinergic effects of promethazine. It can also produce urinary retention and urinary obstruction. Therefore, in people with any prostate enlargement or previous history of benign prostate hyperplasia, promethazine should be carefully used. This effect of promethazine is again due to its anticholinergic effects. It can produce a relaxation of the bladder, which increases urinary retention and reduces urinary output. Promethazine can also produce drying of ocular secretions, so it may impair visual activity. Promethazine may increase the conditions like narrow-angle glaucoma. This is because of its anticholinergic effects. It increases the intraocular pressure due to decreased drainage of aqueous humor. This may result in blurred vision and increase the risk of glaucoma. This medication can block dopamine receptors in your brain. Therefore, it can produce a set of symptoms called extrapyramidal effects. It may result in a condition called pseudoparkinsonism. It results in the Parkinson's-like symptoms leading to slow movements, muscle stiffness, and jerky movements. Promethazine can also produce acute dystonias that involve involuntary muscle contractions, leading to abnormal movements. You may also have restlessness with use of this medication. This medication can also produce another condition called neuroleptic malignant syndrome. It involves the muscle rigidity, increased blood pressure, tachycardia, excessive sweating, and altered mental status. Promethazine may cause orthostatic hypotension. It may reduce your blood pressure, particularly when you change your posture. It may also produce lightheadedness and drowsiness. Therefore, in people with any previous history of cardiovascular disease or cerebrovascular disease, hypotensive effects may be observed. In people with low body volume, again, a hypotensive effect may be more pronounced. This orthostatic hypotension is due to a block of alpha-1 adrenergic receptors by promethazine. Normally, these receptors are responsible for the constriction of your arteries, which increases the blood pressure. Since this medication blocks these receptors, it can produce a drop in your blood pressure when you change your posture. If you're taking other medications that induce either hypotension or bradycardia, this orthostatic hypotension may be more enhanced by the use of promethazine. Promethazine can also increase muscle weakness in people with myasthenia gravis. The antiemetic effect produced by promethazine may mask the toxicity of anti-cancer agents. Normally, anti-cancer agents can produce emesis. The extent of nausea and vomiting increases with their toxicity. Use of promethazine along with the anti-cancer agents may mask this toxicity. Therefore, care should be taken to check the other symptoms of toxicity when you are taking anti-cancer agents. Promethazine can produce some photosensitivity. Therefore, avoid direct exposure to sunlight when you are at higher doses. Promethazine can produce respiratory depression, which is more pronounced in the children with an age less than 2 years. Therefore, this medication is contraindicated in children below 2 years. In people with compromised respiratory function, promethazine may be avoided. If you have chronic obstructive pulmonary disease or sleep apnea, this medication is contraindicated. Promethazine can reduce the seizure threshold. So if you have any previous history of seizures, this medication may increase the risk. If you're taking medications like narcotic analgesics or local anesthetics, they may also increase the seizure risk. With such medications, use of promethazine can significantly increase the seizure risk. Now let's see the side effects of promethazine. This medication mainly produces a few side effects like sedation, confusion, blurred vision, hallucinations, and disorientation. Dystonia results in the disturbance in the muscle movements. It can also produce tachycardia, excitation, dry mouth, and photosensitivity. Other side effects, like urinary retention, can also be observed. That's all, guys. These are the essential facts that you should know about promethazine. Thanks for watching this video. If you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.